Good afternoon. We have a lot of ground to cover, and there's going to be some nasty weather, which Pat will give more details on. So we're going to get right at it and ask you all if you could be economical with your questions. We got a full house today. I am joined by the woman on my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right today, we've got the Department of Health's Communicable Disease Service Medical Director, another familiar face, Dr. Ed Lifshitz. Great to have you both. To my far left, another guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We're also joined today, to my left, by Interim Commissioner of the Department of Education, a guy who's been here before, Kevin Deemer. Kevin, great to have you here. To my far left, Willingboro Public Schools Superintendent, Dr. Neely Hackett. Great to have you with us. And to the far right, East Brunswick Public Schools Superintendent, Dr. Victor Valesky. So thank you all for being here today. We also have our Chief of Policy and former Secretary of Higher Education, Dr. Zakiya Smith-Ellis, with us today. The Director of the Department of Homeland Security and Preparedness, Jared Maples. If that weren't enough, the head of our Intergovernmental Affairs team, Mike Delamater, is with us, and many others. Before we get into education matters, I want to say that about an hour ago, the New Jersey Supreme Court rendered its unanimous decision allowing us to move forward to borrow the funds we need to protect the vital jobs and programs that are critical not only to our ongoing response to this pandemic, but which will play a huge role in our overall recovery. I am grateful for this decision because we knew that not only were we right in our decision to take this step, and I want to give a particular shout out to the legislative leaders, Senate President Steve Sweeney and Assembly Speaker Craig Coughlin, who took these steps with us, and I've had a good exchange with each of them in the past hour. So we were right collectively in our decision to take this step, but also because the alternative would have been something that no one up here or anywhere would have wanted to experience. This means that, for instance, when I present our new budget for the fiscal 2021 year in roughly 2 weeks, our schools can be funded, our residents and communities can be protected, and our state can move forward. We are going to continue our work to strengthen New Jersey's fiscal foundation and build on the progress of our first 2 years. However, I must be clear that even with this decision, we are not declaring victory. We have a long road still to travel. We still need the federal government to step up and provide direct assistance to us and our fellow states. This cannot continue to twist in the political winds. This isn't about red or blue. This is about keeping our nation strong and preventing this recession from falling into a depression. And we cannot rely on half measures that were proposed over the weekend that have no clear guidance and which push even more costs onto states. Money, I might add, that we don't have. For example, the president's proposal for additional unemployment would actually cost New Jersey an estimated $1.725 billion just this calendar year. And that's just in potential benefits, not even the cost of setting up a system that we don't even have. We need Congress to act. We need Mitch McConnell to finally get something done, and we need him to do it now. You know that phrase, go big or go home? It's hard to believe this, but he went home. At this moment in American history, it requires an American response that we've seen over the past 2.5 centuries. And with all due respect, Senator McConnell, history will be kind to us and to you if we overshoot, if we go too big. But history will be unsparing if we come up small as you have so far. Borrowing is not anything that any one of us wanted to have to do. But Washington's inaction and indifference has left us no choice. As we battle this pandemic and look to our recovery, we must be prepared to have every tool in our toolbox at our disposal to protect our state and to keep it a great place to live, to work, and to raise a family. And when it comes to raising a family, Kevin, that turns us invariably to educational matters. And with that, today I am signing an executive order officially clearing both our pre-K through 12 schools and our colleges and universities to reopen for the upcoming academic year. As many of our colleges and universities have continued offering classes during the summer, in-person instruction may fully resume immediately should institutions so desire, and so long as social distancing, among other protections, are strictly adhered to. And any student who chooses to continue remote learning must be accommodated. We have held ongoing discussions with the leaders throughout our higher education system, and we believe they are ready for this step. In fact, I have a call with presidents of colleges and universities on the books for tomorrow. And throughout the summer, we have continued to work alongside our school districts and educational communities, including educators, parents, and other stakeholders, to ensure that come the beginning of the school year in September, plans are in place to ensure the safety of all students and staff. I have personally been a part of, I think at this point, scores of those deliberations, consultations, discussions. Let's begin by reiterating a very simple truth. Not only will this not be a normal school year, furthermore, there is no one-size-fits-all plan to this very difficult situation. As we have mentioned here before, we are home to nearly 600 public school districts, plus charter and Renaissance schools, non-public and parochial schools, and other specialized places of learning. Each one faces its own unique challenges, serves a unique community, and has its own unique character. And I think Commissioner Deemer and Drs. Hackett and Valesky can certainly attest to that. And in fact, we don't just recognize these differences in New Jersey. In many ways, we celebrate them. The simple fact remains that New Jersey's system of education has long been rooted in local control and decision-making based on local input. I would not ask the students and parents, for instance, in Willingboro, to decide what's best for East Brunswick schools and vice versa. And so for the past 6 weeks, we have relied upon the work of local educational communities to determine the best way for their schools to reopen. We have provided significant flexibility, including providing parents and guardians with the option to choose all remote learning for their student, while also at the same time adjusting expectations based on the latest science and data, such as, by the way, last week's announcement of mandatory face coverings for all students while in school. But in every twist and turn on the road, we have been willing to listen and to accommodate. And today we are continuing to show our willingness to listen, to learn, and to act accordingly. This clear principle has guided us from the very start, and it will continue. We are flexible because we value listening, and we are listening because we value flexibility. This is not a change of course. This is a continuation of the process that we set up from the very start. The Department of Education has put forward strong guidelines that put a premium on health and safety of students and staff while allowing in-person instruction to resume. However, we recognize that for some districts, there are legitimate and documentable reasons why some of these core health and safety standards cannot be met on day one. So for these districts today, we are reaffirming our commitment to provide the flexibility for districts to do what is best for their school community. Both public and non-public schools must certify to the Department of Education that they are able to meet the health and safety standards necessary to resume in-person instruction. Districts that cannot meet all the health and safety standards for safe in-person instruction will begin their school year in an all-remote fashion. Public school districts will need to spell out their plans for satisfying these unmet standards and a date by which they anticipate the ability to resume in-person instruction. As I mentioned, throughout this process, we have talked directly with administrators like Drs. Hackett and Valesky, with educators, with parents, with national experts, and with countless other stakeholders. And just as importantly, not only have we spoken with them, we have listened. Our goal has not changed. Our commitment to meeting the conditions on the ground with flexibility has not changed. And most of all, our focus on protecting students, families, and educators has not changed. When our schools open in September, they must be ready to provide the high-quality education to all students that is a hallmark of New Jersey. We know the first day of school is not going to be like any other in our history. And we are fully committed to getting this right for students, our educators, our districts, and every family, that everyone who enters one of our schools goes safely home at night. I know Judy will have more to say on this. In addition to our educational experts, Judy will have more to say on this in a few minutes as it relates to the health perspective on this. So thank you to each and every one of you. With that, let's turn to the overnight numbers. Today, we're reporting another 484 positive test results for a statewide total of 185,938. Judy, our numbers are generally good, but I would be remiss, and I know you would as well, if we did not say that both for today and yesterday, we are reporting positive cases that hover just under 500 per day. Let's keep all of that in mind, folks. The percent positivity rate for tests from August 8 was 2.09%. That's very good. It's up a little bit. And the rate of transmission currently sits at 0.92, and that happily is down a little bit. In our hospitals, there were 296 COVID positive patients being treated, with another 296 patients listed as persons under investigation pending their test results, for a total of 592 persons hospitalized with COVID-19, either symptoms confirmed or presumed. There were 111 patients in intensive care, and 35 ventilators were in use. Today, with heavy hearts, we report that another 9 deaths are now confirmed to be due to COVID-19 complications, bringing the statewide total to an unfathomable 14,046. The number of probable deaths has been adjusted slightly to 1,839. Last night, Judy, there were, as I read the dashboard here, 13 deaths reported in our hospitals. And these are still, again, pending confirmation that they're from COVID-19 complications, meaning they're not included in that slide. But that should all also give us a moment to reflect and remember those folks. Of the 9 deaths that we are reporting today that are confirmed, there is 1 each of the 4 days from August 6th to 9th. The other 5 range in dates from as far back as July 16th to August 3rd. Now let's take a moment, as we do every day, to recall several more of those we have lost. Today is an extraordinary, I want to brace everybody for this, an extraordinarily tragic story. We remember Larry and Vicki Frieda on the left and their son John on the right. One family. On April 22nd, John lost his battle with COVID-19 1 month shy of his 52nd birthday. He was a Jersey product all the way. He was a graduate of West Essex Regional High School and Raritan Valley Community College. He was an optician, most recently helping customers at the Walmart Optical in Riverdale in Bergen County. His family speaks of his creative soul, of his love of writing and drawing and working on art projects. He was an avid reader and movie buff, especially anything dealing with superheroes. He loved his family and friends and would dedicate hours to searching for the perfect gifts. Bless you. The 4 words that best summed up John were funny, thoughtful, intelligent, introspective. But only 2 days, folks, after losing John, the Frieda family lost both Larry and Vicki, I believe, within an hour or 2 of each other. Larry was just weeks shy of his 86th birthday, and Vicki had only recently turned 83. They had been married for 62 years and had spent 58 of them together in Fairfield, where they raised their family. They were inseparable. And there is a tragic poetry, as I mentioned, that they would both leave this life on the same day, literally within hours of each other. Larry was born in Newark and served in the United States Army during peacetime stationed in Europe. After his service ended, he began a 24-year career at the former Pabst Blue Ribbon Brewery. I mentioned to their son Alex that I was formerly a large customer of theirs in Newark before becoming a custodian at West Essex Regional High School, where his children, by the way, as I mentioned, were educated. He was a fixture in Fairfield, and nearly everyone knew him for his tremendous sense of humor and infectious smile. Vicki was also born in Newark, a member of the West Side High School class of 1954. She made her career serving the township of Fairfield before her retirement in 2007, with her final posting being as executive secretary to former Mayor Rocco Palmieri, who eulogized her as, quote, the epitome of what a public servant should be. And by the way, you should look up that eulogy. Their son Alex said it was extraordinary. Outside work, Vicki could fulfill any request for a Halloween costume, an art project, or a holiday ornament, and she often composed special poems for family and friends. Obviously, she passed her creative talents on to her son, John. She was a den mother in the Cub Scouts for each of her 3 sons, but even more, she loved being the den mother of a large New Jersey Italian family. Neither Larry nor Vicki wanted to sit still in retirement, and they settled into their second act as full-time grandparents, going to sporting events, plays, and choirs, anything that meant spending time with their family. They also enjoyed taking gaming trips to a casino, always having fun regardless of whether they ended the day up or down. And while Larry did break away for early morning to have coffee with his friends in downtown Fairfield, he always waited to return home to share breakfast with Vicki. So their son John leaves behind his sons, Brian, David, and Adam. Those are 3 of Larry and Vicki's 6 grandsons. And for reasons I won't get into, please keep those 3 lads in your prayers that they will find inner peace. Larry and Vicki also leave behind their 2 other sons, John's brothers, Larry and his wife Mary, and Alex, with whom I had the great honor of speaking on Wednesday, and his wife Joanne. Larry and Vicki are also survived by their 3 other grandsons, and John by his 3 nephews, Matthew, Kevin, and Alexander Jr., along with countless other families and friends. 3 tremendous and loving souls, all taken from the same family within a span of 48 hours. The Frida family remains in our thoughts and our prayers. May God bless Larry, Vicki, and John. Larry, thank you for your service to our nation. And may the good Lord bring peace to the Frida family, whose grief was compounded beyond any comprehension. The Frida family is just one of thousands of families who know all too well the awful strength and power of this virus. For them and for us all, we must continue to do everything we can to slow the spread of this virus and save lives. We must keep up with our social distancing, and we must continue to wear our face masks. We have to think of others, of our own family and friends and our communities, and put the common good above all else. We have lost over 14,000 of our fellow New Jerseyans, likely 16,000 and more. Remember that, 14,000, 16,000. Unrelated to these deaths and unrelated to COVID, I do want to give a shout out to some dear friends in an iconic New Jersey family, the Tisches, who suffered an enormous tragedy earlier this week. They may not live necessarily in New Jersey, but they hail from, in many cases, Atlantic City. Newark continues to benefit from their philanthropy, and along with the Mara family, they continue their stewardship over the New York Football Giants. Their loss, their memory, their family is in our prayers. Switching gears, I'd like for us to recognize another of the small businesses who not only make our economy as diverse and as strong as our people, but who we'll be relying upon in the weeks and months ahead as we rebuild and recover from this pandemic. Let's hear it for Fern Glemby. And she is the power behind Card Plus Empower, the Hillsdale-based electronics payment solutions firm that she founded in 1996. Unlike many of our businesses which had to close their doors during the pandemic, Fern is one of the businesses who have found real opportunity. And her small business is now helping countless other small businesses across our state to convert to cashless and contactless point-of-sale technologies. Fern was able to use a grant from the New Jersey Economic Development Authority to not only shore up Card Plus Empower, but to help them reach out to the merchants they work with to ensure their viability as well. In this new business environment, Card Plus's technology is having a true impact, and at least 2 of her clients already report that they are now bringing in more business revenues than before the pandemic hit. I had the great pleasure of speaking with Fern on Monday, and I thanked her not only for making New Jersey Card Plus home, but for also all she is doing to help other small businesses not just survive, but thrive in one of the most challenging times imaginable. And I am proud that through the EDA, we've been able to partner with her to make some of that happen. Additionally, today I am proud to announce that the EDA is launching the first phase today of the New Jersey Small and Micro Business PPE Access Program. This $15 million program is designed to ensure that our small businesses and nonprofits have access to fairly priced personal protective equipment. For more information, please go immediately to covid19.nj.gov/PPE. Partnership is what has gotten us through the past nearly 5 months. It's the partnership that we have forged with our businesses, with our communities, with our healthcare systems, with our essential workers, with each and every one of you. Together, we are proving that there's nothing New Jersey can't do if we all pull together. And with Kevin and Drs. Hackett and Valesky, we are showing that our partnership with our educational communities will produce results that ensure that our schools remain strong and our communities safe and healthy. Now, before I close, I want to make a quick observation about the selection of former Vice President Joe Biden, of Senator Kamala Harris to be his running mate. I'm thrilled for each of them. And by the way, I say this, it's not, my comment is actually a lot less about politics. It's a nice note about Judy, New Jersey. I feel like the in-laws here, by the way, as I say this. Both Jill Biden and Senator Harris's husband, Doug Emhoff, have New Jersey roots. Dr. Biden was born in Hamilton, and Doug grew up in Matawan. So both halves of the Democratic tickets have New Jersey roots. Why should we be surprised by that? Every good story runs through the Garden State. And so with that, it is my pleasure and honor to introduce the interim commissioner of the Department of Education, the guy to my left who's doing a terrific job with his colleagues. Please help me welcome Kevin Deemer.
Thank you, Governor, for the opportunity to be here today. And I want to thank Dr. Victor Valesky, Superintendent of East Brunswick Schools, and Dr. Neely Hackett, Superintendent of Willingboro Public Schools, for all you do for the students in your districts. In June, we issued our initial school reopening guidance. We explained that it was created with the input of hundreds of stakeholders. As we said previously, this document will continue to evolve based on changes in health-related data, direction from the New Jersey Department of Health, and input from stakeholders. As we prepare for school to resume, stakeholder input continues to be a hallmark of our guidance. With more than 600 school districts and charter schools, there isn't a one-size-fits-all plan to reopen schools. We've shown that we've been responsive to the concerns of stakeholders. We saw an example of this just last month when the governor announced that every parent will be able to select all remote learning for their child if they choose. This option to give families a greater sense of ownership over the decision to resume in-person instruction was a direct response to feedback that we received from both parents and school officials. Today, this executive order addresses 2 of stakeholders' most pressing needs. First, ensuring schools can resume in-person instruction while meeting health and safety standards. And second, allowing the time that school communities need to plan for and implement those health and safety standards while continuing to provide instruction and other school services remotely. Educators and pediatric experts around the country agree on the importance of in-person instruction to a child's educational and developmental growth. And we all agree that in-person instruction needs to be done as safe as possible. This executive order reinforces that school districts must open to students for in-person instruction where the school district meets the department's health and safety standards for reopening. as set forth in the road back. However, we are also sensitive to the concerns of those school leaders who say they need additional time to implement the health and safety precautions identified by the Department of Education and the Department of Health before they can return any portion of the student population to in-person instruction. The flexibility we're announcing today provides school districts that time while ensuring that the entire state continues progress towards safe in-person instruction. The two superintendents here today demonstrate why we need this flexibility. One district has been able to meet the health and safety standards in the state's guidance. The other district is committed to returning to in-person instruction, but needs more time to meet those health and safety standards. Districts that need this flexibility must demonstrate that they are unable to meet one or more of the state's health and safety standards. They must continue to make good faith efforts to meet those standards to safely reopen school buildings, and they must define the date by which they anticipate in-person instruction to resume. To support districts' planning efforts, the Department of Education has been working closely with the Department of Health. We thank our partners at the Department of Health for their invaluable leadership and expertise in developing forthcoming guidance to local health authorities on public health recommendations for school settings, and for their expertise in developing the minimum standards that districts need to implement in order to safely open to in-person instruction for the upcoming school year. We are confident their guidance will provide a useful guidepost for schools and local health authorities to develop procedures for responding to and mitigating the potential spread of COVID-19 in school communities based on local needs and circumstances. By balancing the educational and developmental benefits of in-person instruction with the planning time necessary to implement health and safety standards, this executive order provides a strategic and responsible reopening of New Jersey schools, ensuring that educational health does not come at the expense of public health. I want to thank the governor for his continued leadership to ensure that the health and safety of our students and school personnel remain a primary focus as we approach reopening our schools. Thank you.
Kevin, thank you. I also want to give a shout out to Deb Kornavaca, Deputy Chief of Staff, who's been right in the thick of the educational and other policy areas over the past many months. So Deb, good to have you there. Thank you, Kevin, for your leadership, for your teams, and I know some of them are with us today. We wanted this to be the least abstract discussion we could possibly make it, given the capacities, and we're right at the edge of our social distancing here, so forgive us for that. We have more people on the dais than normal, but we felt strongly that it made sense to have a couple of superintendents with us today who are at the front lines of this, and who are facing different dimensions depending on the school district. As we've said many times, there are no two school districts alike, and we repeat that. And it's both a source of big challenge in terms of it as it relates to policy and getting everything in line, but it is also a source overwhelmingly of the best public education system in the United States of America. So with that, please help me welcome for a few remarks from East Brunswick, a great New Jersey community, the superintendent of their public schools, Dr. Victor Valesky.
Thank you, Governor Murphy and Interim Commissioner Deemer. Beginning in mid-March, when we all shifted to distance learning, East Brunswick began a comprehensive investigation into how our recovery would look and how it could meet the needs of our unique constituency. For us, an essential part of that process was evaluating our daily activities and reevaluating every action and interaction around 6 distinct priorities. First was analysis of the spaces we utilized for teaching, learning, gathering, and transporting students. Second was placement and organization of students and staff within those spaces. Third was integration of medical, social, and emotional supports with academics. Fourth was communication that is timely, accurate, and consistent for families and township leaders. 5 was, of course, environmental safety, and 6 was physical security. Our objective was to exceed the minimum requirements articulated in the roadback guidance from the Department of Education. Our stakeholder groups represented the diversity of our schools and community. They all share the same desire to make our plan the absolute best it could be under the conditions and constraints we know now. Our plan had to be flexible and adaptable, as we know those constraints could change between now and our anticipated start of school. Above all, safety must remain our dominant decision factor. And based on the feedback from a survey we distributed to families, nearly 70% of the respondents desired some form of hybrid instructional model for their children, versus about 30% for the full virtual option. We are pleased to say that in East Brunswick, we will be able to meet the health and safety standards outlined in the road back and return to our classrooms in the fall, all while keeping our students and staff safe. While a return to full-time in-person instruction is not possible for East Brunswick Public Schools, we are confident that the hybrid plan we are offering our students will ensure that all students, regardless of where they'll be during the school day, receive a high-quality education. This plan will allow us to provide safe transport for our students, as well as follow social distancing protocols for our classrooms and in our hallways. Our classrooms will be set up to maintain physical separation between students and teachers. In our model, all students will participate in virtual learning to some extent, but our standard grading, assessment, and attendance policies will be enforced. Our elementary schools model begins the school year with 2 cohorts, each designed to accommodate 50% of the school's enrolled population. Also in our elementary schools, special area teachers move to students rather than students moving to them, limiting student interaction outside their classroom bubbles. In a similar fashion, our secondary schools model has 4 cohorts, each representing 25% of each school's enrolled population. Our cohorts of elementary and secondary students will follow our established arrival times, whether they are face-to-face or virtually logged in. And while we'll not be serving lunch in our cafeterias because of social distancing limitations, grab-and-go meals will be available under the same guidelines as regular lunch service. And across the district, after midday dismissal, allowing time for students who have attended school to be transported and have their lunch, virtual instruction and support will continue until the end of each school's regularly scheduled day. One of the features incorporated into our model is sibling alignment. So, to the extent possible, children in the same family unit attend school on the same days. Additionally, to protect the health and safety of our staff, we have constructed enclosed security vestibules for our school security officers who manage entry into each of our school buildings. Plexiglass barriers are or will be installed at high-volume secretary desks and where we cannot maintain adequate distancing between staff workstations. I also want to take this time to thank Governor Murphy for the additional funding you have provided to close the digital divide. Those resources will accelerate our efforts to ensure each K-12 student will have current and reliable instructional technology for their individual use and can remain connected to teaching and learning while not physically in school. I know my peers in Middlesex County, as well as my peers throughout the state, along with their school boards and district leadership and township leadership, are working hard to develop and implement plans that address their unique constituencies. Funding and human resources, as well as facility space and childcare, became limiting factors for many of the solutions that we all had considered. East Brunswick's plan is just an example of a collaboration among many that attempts to meet the needs of many of the stakeholders in the East Brunswick community. Along with the East Brunswick Education Association, the East Brunswick Principals and Supervisors Association, our Board of Education and parents, we will continue to refine our model as we develop solutions to unexpected challenges and look forward to our complete return to school. As I told our community, our plan is built with passion, but implemented with compassion. Thank you, Governor.
Dr. Valesky, thank you. Incredibly well said. Again, East Brunswick is one of the great New Jersey communities, and its school system is a big reason for that. So thank you for your leadership, and to all the stakeholders there, your staff, educators, principals, parents, community organizations, and most importantly, our precious kids. So thank you. And we are thrilled to have another incredible and iconic community represented here today. Willingboro is with us. Again, one of New Jersey's great communities, and with us today is the superintendent of its public school system. Please help me welcome Dr. Neely Hackett. Dr. Hackett?
Thank you. Good afternoon. I'd like to thank Governor Murphy and Interim Commissioner Kevin Deemer for their commitment to flexibility as school districts work to reopening plans during this unprecedented time. I'd like to acknowledge the Willingboro Mayor, Dr. Tiffany Worthy, who's present this afternoon. Dr. Worthy. It is an honor to participate in this press briefing and represent the Willingboro Public Schools, the Willingboro School Board, and the entire township of Willingboro. To my colleague, Superintendent of East Brunswick Public Schools, Dr. Victor Valesky, I applaud you, your staff, and your community for the development of a comprehensive reopening plan, and I wish you much success for the upcoming school year. I'd also like to take the opportunity to commend the Willingboro Reopening Committee, subcommittee members, and parent and community participants on their tireless efforts expended in creating a comprehensive reopening plan for the Willingboro Public Schools. The plan is grounded in providing students with a quality educational experience under the umbrella of an environment that is physically and emotionally safe for all. The reopening plan was developed using real-time data and information from the New Jersey Department of Education, the New Jersey Department of Health, the Burlington County Department of Health, the Centers for Disease Control, and parent and staff surveys. The reopening plan includes options 1 and 2. Option 1 is designed to divide the school into 2 groups, an A group and a B group. Each group would attend school face-to-face for 2 days per week, either Monday or Tuesday, or Thursday and Friday. The remaining 3 days per week, students would be engaged in virtual learning. Teachers would work all 4 days instructing the A and B groups, and they would also post work to Google Classroom for students who were assigned to virtual learning. Parents can request an all-virtual learning environment for their students. Our most complex learners with individual education programs and pre-kindergarten students will attend school all 4 days, Monday, Tuesday, Thursday, and Friday. Option 2 is designed for students to learn virtually all 5 days. Synchronous instruction will begin at 8 a.m. and conclude at 1 p.m. Class periods will run approximately 45 minutes to 1 hour, and students and staff will have a 30-minute recess period. The 5 days of live instruction will be recorded so that students who miss class can watch at a later time. While our goal remains to achieve in-person learning, our district determined that we were simply not ready to move forward with option 1 at this time. To this end, on July 27th, the Willingboro Board of Education, under the leadership of President Carlos Worthy, voted at its public meeting to submit Willingboro's reopening plan to the New Jersey Department of Education with a request to move to option 2, the all-virtual learning model, for the first marking period, September 8th through November 18th. It is imperative that I note that the Willingboro Board of Education members are committed to the return of students to the classroom for in-person learning. This is the ultimate goal. However, before this return is possible, the Board of Education members must know that all appropriate safety precautions are in place. Although the staff of the Willingboro Public Schools has worked extremely hard over the last several months, there is still much work that needs to be done to ensure the safety of our students and staff. Some of our current challenges are as follows. Number 1, inadequate HV systems to properly ventilate rooms. This can serve as a major issue in regards to the high temperatures during the month of September. Many of our schools have only partial air conditioning, making the early months of the school year an additional challenge. We are currently researching appropriate ventilation systems. While we have worked to secure protective equipment, we still face some backorder issues. We plan to provide all of our staff and students 2 face masks per month, which would equal 8,000 face masks per month. Similarly, we face supply issues preventing the full receipt and installation of physical barriers to protect our students and staff when necessary. We are awaiting additional delivery of devices so that we can have a one-on-one initiative in our schools. We currently have one-on-one initiative for home instruction. We believe we need additional time to fully train our staff on the complexities of the synchronous hybrid learning model and enhanced cleaning protocols. I also want to acknowledge that in collecting feedback from our families, we found that the overwhelming majority were not comfortable sending their children back to school. This is why I'm grateful that the governor and administration provided the parent choice option a few weeks ago to opt out for all remote learning. To ensure all our parents have full visibility and awareness of our enhanced safety measures, we also plan to provide comprehensive virtual training and safety briefings to demonstrate how the district has prepared for in-person instruction and implemented safety protocols. As a community, we are committed to providing Willingboro students with an education that is grounded in 21st century thinking and learning. We will remain committed and will work toward every necessary step to prepare our buildings, students, staff, and parents for in-person learning to begin on November 19th, 2020, the start of the second marking period. We are truly experiencing unprecedented times. However, it is during this difficult time that I find encouragement in knowing that the future leaders and change agents are students in our public schools. They are our hope for a better tomorrow. I commend all of the public school districts for their laser-like commitment to developing a plan that will benefit the students and staff of their respective communities. The 2020-21 school year will not be normal in any sense of the word, but it will be productive for the Willingboro students. With the support of our community, we will provide our students with a quality education within a safe and secure learning environment. And I look forward to the time that we can return to in-person learning. I wish all the best to my colleagues across the state of New Jersey as you work toward one of the most essential responsibilities of a community, the education of its youth. May God bless our children. Thank you.
Thank you so much, Dr. Hackett. So well constructed and so well thought out. I have to say one of the shortcomings of wearing face coverings is I'm less able to recognize people like I used to. So huge apologies and shout out to one of our dear friends, Mayor Tiffany Worthy, who's with us today. Mayor, bless you. Great to have you with us in your leadership in Willingboro. Dr. Hackett, again, thank you for everything you do. And Burlington County, I'll just pick an example, Herb Conway, who wears a couple of different hats, including in his health capacity in Burlington County. Chairman in some of the most important assembly committees, a great assemblyman. It's a county that works. It's a community that works. And to you, Mayor, to you, Madam Superintendent, and to all the folks with whom we deal, as you said, especially God bless the kids who are going to benefit from all of the great leadership. So again, to Dr. Valesky, thank you. Dr. Hackett, thank you. And Kevin, thank you for your leadership. With that, let us turn to the woman who needs no introduction, not just for her daily update, but also her take on some of the educational matters that we're discussing here. The Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. Well, the Department of Health continues to collaborate with the Department of Education as they plan for the upcoming school year. Our guidance in this regard is being finalized and will be posted shortly. To assess the spread of COVID-19 in the state and how it may impact schools, we have been in daily meetings with the Department of Education to develop guidance that fulfills our mission to provide a safe environment for students, teachers, and staff. New Jersey Department of Health is implementing a statewide approach, but with a regional and local focus to be responsive to the local characteristics of school participation. We've divided the state into 6 regions. These regions are similar to how we managed flu surveillance. These regions are the Northwest, Morris, Passaic, Sussex, and Warren. Northeast, Bergen, Essex, and Hudson. Central West, Hunterdon, Mercer, and Somerset. Central East, Middlesex, Monmouth, Ocean, and Union. Southwest, Camden, Gloucester, Burlington, and Salem. In the Southeast, Atlantic, Cape May, and Cumberland. As I said, this is not new. These are similar to how we manage flu surveillance and provides a guide as we continue our journey in mitigating COVID-19. Now, depending on the community risk and transmission, there will be 4 color-coded categories: green, yellow, orange, and red. Where a region falls in the color coding categories is based on 3 criteria that are scored numerically and updated weekly: the number of cases in the past week, the percent positivity in the past week, syndromic surveillance in the past week. This regionalized system will provide a view of transmission more locally and help inform decisions on the ground. The risk assessment provides guidance for the local health departments. Risk levels green, yellow, and orange require staff and students to stay home when they're sick or if they have been in close contact with someone with COVID in the past 14 days, and school administrators should be notified of that illness. It provides tools for parents to screen students before sending them to school, screen staff for symptoms upon arrival, and have plans for students and staff to report symptoms during the day. In conjunction with the local health department, it identifies rapid testing resources when staff or students develop symptoms. It offers guidance on cleaning and disinfecting frequently touched surfaces, at least on a daily basis, if not more. It ensures adequate hand hygiene supplies are available, implements physical distancing measures, and source control through wearing of face coverings. If a child becomes sick at school and it is suspected to be COVID-19 related, the child should be isolated immediately and then sent home as soon as possible. It is advised that the child see a healthcare provider for evaluation on whether testing is needed. The guidance will provide information about the length of school exclusion, the role of testing, and the steps to take to respond to suspected and known positive students in schools. Moving on, I want to report that this is National Health Center Week, a time to recognize and celebrate our community health centers as innovators in delivering high quality and cost-effective and accessible care to the residents of our state. New Jersey is home to 24 federally qualified health centers with more than 130 locations around the state that provide a full range of medical, dental, and preventive healthcare services for more than 2.1 million patients a year. They provide a medical home for 590,000 individuals in our state, including many who are among our most vulnerable, including those uninsured and underinsured. These vulnerable populations are also disproportionately impacted by maternal morbidity, infant mortality, elevated childhood levels, asthma, diabetes, and other chronic diseases. The theme of this year's National Health Center Week is Community Health Centers, lighting the way for healthier communities today and in the future. During this once-in-a-lifetime pandemic, they have stepped up in a big way to help New Jersey confront COVID-19 public health crisis. They have taken the lead in testing more than 80,000 people as of early August. They have made testing available since the beginning of the pandemic for our most vulnerable populations, including persons who experience homelessness, migrant and seasonal farm workers, and people who are uninsured, underserved, undocumented, and living in urban centers. FQHCs have been testing in mobile vans, on-site at farms and shelters, and in clinics throughout New Jersey. The seasonal farm workers have benefited from testing from the 4 FQHCs who serve them: Zufall Health Center, Complete Care Health Network, Ocean Health Initiatives, and Southern Jersey Family Medical Centers. As of August 12th, more than 4,780 seasonal farm workers have been tested. The department has also included persons experiencing homelessness among its vulnerable population strategy. We are in the early stages of a pilot program to provide point-of-care testing to this population. Point-of-care testing is recommended for people experiencing homelessness due to the transient nature of the community. The department is collaborating with our FQHCs and local health departments and shelters on this program. To date, we have run 2 pilots and have tested 244 individuals in Trenton, Ewing, Camden, and Patterson at our homeless shelters. Interestingly, all individuals have tested negative. We will scale up testing in other regions of the state for this